Crohn's disease is a form of inflammatory bowel disease. It is a chronic inflammatory granulomatous ulceroconstrictive disease that is caused by the overactivation of immune system. This means there is granuloma formation along with ulcers and strictures, and it has an autoimmune component. The pathogenesis of Crohn's disease involves the exposure of body to pathogens like Mycobacterium, Paratuberculosis, Listeria, and Pseudomonas. Like in any other body, these activate the antigen presenting cells. Antigen presenting cells phagocytose these bacteria and present its antigenic part to other immune cells. Here, T helper cells of type 1 variety are mainly involved. These further activate numerous macrophages through release of cytokines, and these macrophages activate B cells, cytotoxic T cells, and a full-blown immune response occurs against these bacteria. But this seems to be a normal immune response occurring in any individual. But there are certain people who have NOT2 mutations and a certain allele of HLA gene, HLA-DR2. In these people, this immune response initiated is uncontrolled, and instead of killing the bacteria, it affects its own bowel, causing inflammatory bowel disease, Crohn syndrome. Normally, when pathogens come in contact with the mucosa of our GIT tract, they cannot pass through due to the layer of enterocytes and other protective mechanisms. But if somehow in a genetically predisposed patient, these microbes get their way across the mucosa into the deeper layers of the GIT tract and are able to arouse the inflammation described before, in such people, these microbes cause an uncontrolled inflammatory process which not only forms large granulomas that have immune cells surrounding these pathogens, but it also causes the killing of body's own cells of the GIT tract. This inflammation can be so deep that it involves all the 4 layers that line the GIT tract: mucosa, submucosa, muscularis propria, and adventitia. This is known as transmural inflammation. Since in Crohn's disease, the GIT mucosa can be involved in any part of the body, from mouth to the anus. This cell death causes ulcer formation, which can affect any part of GIT tract. Along with this, fissures and fistulas can also form. Fistulas form when 2 bowel loops that are affected and inflamed come in contact, and when healed, an epithelial tract is formed between them. This is known as an enteroenteric fistula. Other fistulas can also form including fistula between bowel loop and urinary bladder, enterovesical fistula, and bowel with the skin, enterocutaneous fistula. The Crohn's disease is notorious for forming skip lesions throughout the GIT tract. This means that different segments are inflamed, which are discontinuous. When the walls of large intestine, which is important for the absorption of water, is inflamed, water cannot be absorbed, and so a lot of water is lost in the feces, causing diarrhea. This in some cases can also include blood. When the small intestine is affected, which is important for the absorption of nutrients from the food, it causes malabsorption of different vitamins, proteins, and fats. Vitamin B12 deficiency causes anemia. Protein loss causes protein losing enteropathy, and when bile salts are lost, fat cannot be absorbed and steatorrhea occurs. The granuloma can present as palpable mass. When the person is recovering and some parts of the inflamed bowel heal, they undergo fibrosis. This fibrous tissue is deposited in the bowel wall and causes narrowing of the bowel lumen. Therefore, when barium studies are conducted, it results in string sign, which means that barium solution hardly passes the narrowed lumen and it appears on the radiograph as a narrow string. Crohn's disease can involve any part of the GIT tract, but terminal ileum is the most affected part. Since it is present on the right side of the body, therefore patient experiences right side abdominal pain, and granulomas here are felt as right-sided palpable masses. Along with it chronic diarrhea, mouth ulcers, and anal disease involving formation of fissures, fistulas, and abscess formation can occur. Malabsorption symptoms previously discussed include anemia, steatorrhea, and the formation of calcium oxalate renal stones. Since fatty acids cannot be absorbed in case of small intestine involvement, therefore it binds to the calcium. Normally, calcium of food binds to the oxalate present in the diet that when it passes through the GIT tract. Since now calcium has been used up, oxalate lies free in the lumen and is absorbed in large amounts into the blood, resulting in oxalate stones. Investigation involves non-specific tests like complete blood count that shows decreased HP and anemia, increased ESR and C-reactive protein that shows inflammation within the body, and presence of anti-Saccharomyces cerevisiae antibodies. Barium studies show string sign explained before. The type involves depending upon the part of GIT tract, it may be barium follow-through or barium enema. CT scan abdomen can also show a detailed picture of the area inflamed, and colonoscopy not only shows us the extent of disease, but it can also be used as a screening process to exclude colon adenocarcinoma if there is a long-term history of colon involvement. Apart from this, the perianal disease is diagnosed by endo-anal ultrasound, in which a probe is introduced through the anal opening, and MRI can also be done.